Hello, my name is Drew Racy, and this is my virtual senior studies presentation. My topic is, does the NFL and NCAA do enough to prevent concussions? The medical definition of a concussion is a traumatic injury to soft tissue, usually the brain, as a result of a violent blow, shaking, or spinning. After a person has had a concussion, he or she is at an increased risk of recurrence. After a person has had several concussions, less of a blow can cause injury, and the person can require more time to recover. In the pastoral letter from the bishops of New Zealand, it states, "Suffering is a shoreless ocean that surged in on Jesus tide after tide." Suffering and pain is not an easy thing to get through. This is why we need to try our best to prevent concussions in the future. Concussions occur as a result of a traumatic blow to the head that causes the head and brain to move rapidly back and forth in a whiplash-like fashion. The sudden movement causes the brain to bounce and twist around on the inside of your skull, stretching and damaging the delicate cells and structures inside your brain. Some symptoms would include dizziness, headache, and memory loss. For my awareness, I watched a 30 for 30 on Junior Seau and the role concussions played in his death. Junior grew up in Oceanside, California, which was full of gangs and prostitution. His goal was to get his parents out of the neighborhood. They were a poor family, so his siblings had to get a job by 13, but his parents saw his potential in sports and they never made him work. As a kid, Junior had to sleep in the garage with his brother. Junior was not only a great football player, but some say he was almost better at basketball. Junior's father was very hard on him. For example, if Junior lost a game in high school, his dad wouldn't give him lunch money for the week, even though he would have 20 tackles and 3 touchdowns. This made Junior give it his all on everything he did, and losing was never easy for him. Every college in the nation was trying to get in touch with Junior, but he decided to stay at home and commit to USC. But Junior's SAT was 10 points under the minimum, so he had to sit out his freshman year. Junior's father wouldn't even talk to him, which really took a toll on Junior. His freshman year, he never left the weight room. His teammates would say they've never seen anyone work so hard. The next season, on the field, he was an uncaged animal, and nobody could stop him. He decided to forego his senior season and declare for the draft. Junior was drafted by his hometown San Diego Chargers, and he was ecstatic. When he was a rookie, he displayed great leadership, and everyone could tell he was going to be a star. After his rookie year, he broke out and was considered one of the best linebackers in the league. He married a girl who worked as a marketer for the San Diego Chargers. They ended up having 3 kids, and Junior loved them with all his heart. They all described him as the best dad they could ask for. Junior strived not to be like his dad, and he spoiled his kids. He even opened a foundation for local children who didn't have a lot. But Junior was a whole different person on the field. He did everything he possibly could to win. His teammates would say that he had the biggest pain threshold they've ever seen. Not many people would report concussions back then because they didn't want to seem weak. And in the Catechism verse 2477, it says, "Respect the reputation of persons forbids every attitude and word likely to cause an unjust injury." This is very accurate, and if players followed this, it would prevent so many injuries. Junior said that he would come off the field after getting what most likely seemed to be a concussion and go back in just after a few plays. In 1994, he made it to the Super Bowl, but the Chargers ended up losing and he took it very hard. He ended up getting sick of losing, and the Chargers traded him to the Miami Dolphins. But after 2 years, he was released and he retired. But during his retirement speech, people were very concerned as he was sweating profusely and rambling on about just random things. The next day, he decided to come back and join the Patriots. That year, the Patriots made it to the Super Bowl, but they got upset by the Giants. After this, Junior was done, and he called it quits for good. After retirement, his wife said he would act as a completely different person. She said they would get into arguments, and the next day, Junior would completely forget that they even happened. He even had a journal where he mentioned all of his problems, but in reality, he was too scared and didn't want to seem weak, so he wouldn't bring them up to anybody. His wife eventually got fed up with this and filed for a divorce. Junior eventually started gambling more, and started to not care about anything. He opened up to one of his close friends, and he admitted to him that Junior had a constant headache since he was only 15 years old and he couldn't take it anymore. Junior started becoming distant and forgetful. He would forget to pick his kids up and get in arguments and yell at them, which before he would never ever think of doing. Junior was a giver his whole life and could never ask anyone for help, even though he was enduring an enormous amount of pain. His kids confronted him about how he was acting, and he told them he doesn't know how to love anymore. Junior started drinking and gambling and got himself into debt. One day he drove himself off the side of a cliff, and everyone was very concerned, but he kept insisting that it was an accident. But after this, his family was very concerned and eventually agreed to help. But the day that Junior was supposed to go to the therapist, he canceled and he decided not to go. But that same day, he was found dead in his bedroom with a bullet hole in his chest. One player before Junior also died like this. This was Dave Duerson. He killed himself the same way, but in Dave Duerson's suicide note, he wrote how his brain is messed up from the NFL and he wants his brain to be studied. The NFL would deny that all these brain diseases were linked to concussions. Junior's brain was studied and found to have an awful case of CTE. The NFL fought the CTE evidence as much as they could, but they lost, and after Junior's suicide, they were forced to change their rules and much else. But to this day, the NFL concussion rate hasn't dropped too much. Lots of former players are now speaking out and trying to help others after what happened to Junior. For my expert interview, I interviewed Dr. Mohan Mysore, who was the head of the Pediatric Intensive Care Unit at Boys Town. Here is some of the important information he gave. He made a very good analogy with concussions and Jell-O. He stated, if you have Jell-O in a box and shake it really hard, the fibers inside will become disconnected from the other fibers. This is the same with the brain and the cells inside. Dr. Mysore also mentioned some of the long-term effects, which include memory loss, learning disabilities, and at risk of CTE, which Junior had. He also mentioned that there's no max number of concussions before you have to quit. But it depends on the severity of the concussions. You could be done after one, or you could still be playing with 7 minor concussions. Lastly, Dr. Mysore gave his take on how to make football safer. And he said, by better helmets, stricter penalties for direct hits to the head, and most importantly, raising concussion awareness overall. Many people think that the concussion crisis is coming to a halt, but that couldn't be farther from the truth. Despite what you think, concussions actually went up from the 2018 to 2019 season last year. In 2018, there's 214 concussions, and in 2019, there were 224. There's much more the NFL could do, but they don't want to lose views. Fans love the hard hits, but if we want to keep the players safe, those hits should be illegal. Also, 26 concussions happened last year in preseason practice. Yes, you heard that right. Preseason practice. These are 26 concussions that most definitely can be avoided. If you're in the NFL, you're one tough son of a gun. These players are so prideful. They can never show weakness, no matter what. Winning also plays a ginormous role in concussions. These players will do whatever it takes to win a game. And if that's playing through a concussion, so be it. The Bible verse 1 Corinthians chapter 6, verse 19 through 20 states, do you know that your bodies are temples of the Holy Spirit who is in you, whom you have received from God? You are not on your own. You are bought at a price. Therefore, honor God with your bodies. This is saying we need to protect our bodies as they are gifts from God. This concussion crisis also relates to 3 of the Catholic social teachings. The first is care for God's creation. This relates because God created us, and we need to care for our bodies. Next Catholic social teaching is the option for the poor and vulnerable. NFL players are very vulnerable, and we need to help them in safer the game that they play. The last comparison is with life and dignity of the human person. Every person has the right to live a full and healthy life. It's not fair when retired players are out here committing suicide. Concussions in college. Concussions are not only a problem in the big leagues, but in college too. The average is about 4 concussions per team in a season, which adds up to 520 total. At least in the NFL, you're getting paid good money to take these hits, but in college, you're not making anything. Concussions present a unique challenge as an athletic injury. In some cases, there are visible outwards signs such as a blank stare, a balance disturbance, or a loss of consciousness. However, in most cases, symptoms are internal. These collegiate athletes are playing for the love of the game, so they're going to stay in the game, and this is a trending problem right now in college football. The NCAA needs to find a more efficient way to protect their players that they're making millions off of. Next is the Concussion Legacy Foundation. And this company is dedicated to solving the concussion crisis by advancing the study of treatment and prevention of the effects of brain trauma in athletes and at other risk groups. They help athletes because they are looking and researching for better and safer ways to play sports where concussions are at risk. The community is helped by the awareness of concussions. They try and really get people to understand how they really are in an injustice. The Concussion Legacy Foundation supports athletes, veterans, and all affected by concussions and CTE. They assist patients and families by providing personalized help to those struggling with the outcomes of brain injury. The next company is called BrainScope. BrainScope is a medical neurotechnological company that is improving brain health by providing objective diagnostic insights that enable better patient care. They created the BrainScope One system, which is on your screen, and is the first and only portable EEG-based radiation-free platform that empowers physicians to quickly make accurate head injury assessments. And a quick fact here is only 1 in 6 concussions are diagnosed, so this device would be a great help in the diagnosis of concussions. And I wrote a letter to Roger Goodell, who is the commissioner of the NFL. I gave him some of my suggestions on how to lower the number of concussions. My first suggestion was to create safer helmets. These helmets would contain much technology and funding. They would be able to tell instantly if a concussion happened, just as the BrainScope did. The next suggestion was to make harsher rules. I personally think the NFL should punish illegal hits to the head harder than they do now, so these players are forced to adapt and hopefully the concussion rate would lower. And that's it. Thank you for listening.